Hi everyone, this is Miss DeLong, and I just want to do a little brief presentation to welcome you back to the school year. And I really believe it's going to be a fantastic year. I've been working behind the scenes with your administrators and your teachers and my fellow nurses, and everyone involved in the district has been doing a great job to make sure that you guys are going to have a wonderful school year. And I just want you to know that even though you don't see me every day at the school right now, I'm still here to help you, and you can reach out to me whenever you need to. And I just want to tell you a little bit about myself for those of you who are new to the school and who I've never met, or those of you who just, are curious. Because I know I'm always curious about what your backgrounds are, and I want to know more about you. So I thought it's only fair to let you know a little bit more about me. So I was born and raised in Cleveland. I went to Miami University for undergrad, and then I went to Case Western Reserve University for graduate school. I worked as an attorney for 12 years before I decided to become a nurse. And I just want to let you know that, just so that you guys know that it's okay to change your mind if you find yourself in one job and decide, you know what, this job sounds like it would be good and I'd like to try that path. I just want you to know it's something I did and I'm glad I did it. I loved being an attorney and I love being a nurse. So both careers to me have been great and worthwhile. I live with my husband and my four kids, and you can see them in that picture below. And I love to go to state parks and national parks, and I hope that you guys all get a chance to get out there and enjoy nature whenever you can because it's very good for your mental health. And then I also will be at Clark. I want to let you know, for those of you who haven't been in the building before, that I'm there every day. So you will have a nurse in your building every day, and if for some reason I'm not able to be there, then a substitute nurse would be there. And that I truly do love coming to work every day. I enjoy the students, the staff, the teachers, and everybody at Clark. So one thing I have loved about our remote learning is Bitmojis. So as my kids can tell you, I have loved Bitmoji since they came out. And since remote learning came about, Bitmoji has exploded. So I am so excited about that. So you are going to see a lot of my Bitmoji self. So here's an example of my virtual clinic, which you've probably seen your teachers have virtual classrooms. But this is a place where you're going to be able to find some resources, and it's actually probably more for your parents if they need information. Over here is about vaccines, so you can click there and just see the vaccine schedule. If any students need medication at school, here's a form that needs to be filled out, and that's available. If you have asthma, then we need to get an asthma action plan. If you have any allergies that I need to know about. And then I'm also going to, throughout the school year, be clicking or filling this board with some information just to help us get through all the changing environments that we're going to have throughout the school year. So I also want to talk to you a little bit about COVID because I want everyone to be aware that CMSD has a COVID hotline, and it is up and running, and the school nurses are operating the line, and they are there for you, and they are happy to help you with any questions you have. This is for our parents, students, staff, anyone who has just a question or a concern, or if you've been diagnosed with COVID. There is a number that we would like you to call, and that is right up here, 216-838-WELL or 9355. So please use that number if you have any questions. There are also other resources. The Cleveland website, actually, let me see if I can go to this because what I want to show you. What I want to show you that's so important on this website, and something that's, if you haven't encountered, you might encounter soon, but if you're trying to get a COVID test and you just don't know where to go, this website is great, and you'll see they list, it changes every day who's able to give you sites or give you testing, what their criteria are. So that is why I want just to keep this link here because you'll be able to go and see where the latest place is. So right now, and especially for minors and students under 10, that's where it gets a little bit more complicated to get testing, especially if you're asymptomatic. But Care Alliance is a location, Neighborhood Family Practice, Signature Health, and it just tells you right here what you need. For example, Neighborhood Family Practice, and actually I've had to use that during this for my kids and for me. We had to get tested and they were wonderful. I'm sure everyone's wonderful, but just so you know, they were wonderful. You just pulled up in the parking lot, you got your test, the results were back quickly. And then Signature Health, and let's see who else is on it today. Asia. So just so you can see it, that's why I put the website and not a flyer here, because I want you just to know that it changes. But any questions, you can just call 838-WELL, and they will direct you to the right appropriate places to get testing, or they will give you whatever information you need. Another resource is the Ohio Department of Health, and I've listed their website right here, and then also the CDC. Those are going to be your three main areas where you're going to want to get information, or if you have any questions, those are the websites, and then again, that CMSD hotline. I really hope that you feel comfortable using it and calling it and knowing that it is staffed by your CMSD nurses and it is confidential. Something else I want to talk about with everyone is isolation versus quarantine, because there's so much confusion, even among healthcare professionals, about isolation versus quarantine and how long you're supposed to be in which one. Isolation is for people who have COVID-19. And how would you know you have COVID-19? Well, first of all, you might have had a test and your doctor told you your test came back positive and you do have COVID-19. However, sometimes testing is not available, so you might call your doctor or reach out to a healthcare professional and they'll tell you, we are treating it as COVID-19 based on the symptoms and what you are telling us. So in either of those situations, you are considered COVID positive. Once you are considered COVID positive, you have to go into isolation for 10 days. The start of the 10 days is from the date of the onset of your first symptom, or if you're asymptomatic, from the day that you received your positive test result. So for 10 days, you are in isolation. At the end of the 10 days, you can get out of isolation. However, if you are still symptomatic, then you have to remain in isolation until you have 3 days of no symptoms. So what is isolation? So isolation is household members should use a separate bedroom and even a separate bathroom if possible. It is also recommended that the COVID positive person eat or be fed in their room away from other household members. Household items such as dishes, drinking, glasses, cups, eating utensils, towels, bedding, and other items should not be shared with the infected person. It is important to prohibit all visitors and non-essential people from being in the home. So I just want to make it clear, you are not leaving your house when you're in isolation unless you absolutely have to. And this can be difficult for people. So that is why, again, it's important if you're struggling with isolation and you need resources, reach out to the 838-WELL CMSD number or to the Ohio Department of Health or the Cleveland Department of Health. And they can help give you resources and information to get you through isolation. Now, quarantine is a little different, and that's why I put it in yellow. So I tried to give you this visual of red, yellow, and green to kind of help guide you. So quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. So you'll hear the word close contact. So if you've been identified as a close contact with somebody who was positive for COVID-19, you are on quarantine for 14 days. That date starts from the date of your last exposure to the person with the confirmed COVID-19. So the last time you saw that person, that starts your 14 days. And I know it's so hard to understand, wait a minute, isolation's only 10 days versus quarantine's only 14. And yes, it is confusing, but 14 days is what they're recommending just to make sure you don't have the disease and that you don't spread it. Quarantining means staying home and away from other people as much as possible. That means avoid shopping, avoid eating out, socializing, going to public places, or being in large crowds. Now, the green, if you're in the green, that means you are not in isolation, you're not in quarantine, you haven't been told that you are a close contact. So we want to stay in the green, which means wear a mask, avoid groups of more than 10, wash your hands, maintain 6 feet of distance, take care of yourself, which is so important right now to eat healthy, exercise, maintain a normal routine. And I know it's hard, but just try to do the best you can. So our next slide, like you see, I told you I love Bitmojis, so this is my favorite slide. I just wanted to give you some visuals for some things that you can do right now, and when we return to school, some things that are going to be in place. First of all, wearing a mask, covering your mouth and nose. And I know everybody has seen people with the mask not on correctly. And really, in order to have the full effect of the mask, it needs to be covering your nose and your mouth. Second, washing your hands. And I know you guys have heard this over and over again, but it truly is so important. Wash your hands 20 seconds if you can with soap and water. And if you don't have soap and water available, then hand sanitizer until you can get to soap and water. Third, you want to not touch your face. Touching your face just transfers any germs that could be on your hands to your face and into your nasal cavity or into your mouth. So you want to avoid touching your face as much as possible. And this goes for really any time, all during the school year, whether it's COVID related, not COVID related. It's just good hygiene to try to avoid touching your face. And I know we all do it. So we're just doing the best we can to be cognizant of it and avoid touching your face. And then four, stay 6 feet away whenever possible, keeping your distance. Number five, if you're not feeling well, stay home. If you even question a little bit, I have a cough, I have a runny nose, I'm not sure, stay home. Call that 838 well number. Talk to somebody there. But this is different than it's been in the past years. In the past years in school, you haven't gone home if you had a stuffy nose and a sore throat. But this year it's going to be a lot different. If you're not feeling well, don't even question it. Don't come to school. And then finally, and I think this is most important, take care of yourself. Get into a good sleep pattern, eat well. When you're stressed, take deep breaths, and just really try to maintain overall good health. And I just don't want anyone to forget that even though we're in the middle of a pandemic, it is still so important to go to those well visits for your child. And this year, the CMSD mobile bus, that's a mobile bus that comes to different schools, it is open to everybody. So you don't have to go to the school where the bus is. All you have to do is reach out to the phone number 216-957-1303 or email that email address on the screen, and they can set you up and you can find a location that's convenient for you to do a well visit. What about catching up with vaccines? If you've missed some of your vaccines, or if you want to get a flu shot, and that is going to be so important this year, go to the Cleveland Department of Health or the County Board of Health, and here is their phone number and a flyer with some dates that they're going to be having drive-up clinics as well. So reach out to them to make sure you're getting all those vaccinations. So that's all I have for you right now. But if you have any questions or anything that you just want to know and I didn't touch base about, please email me. And I check this email frequently. So leave me your number and I'll get back to you. Or if it's an emergency or you just need an answer quickly, there's my phone number and it goes directly to me. And I look forward to working with you all, and I think it really is truly going to be a great year. Thank you.